The AirBAPS is the latest in biomechanical technology used to rehabilitate ankle and lower leg injuries. Physical therapists, athletic trainers, and physiotherapists around the world are using the AirBAPS system to provide their clients with the correct functional reaction techniques to heal ankle and lower leg injuries. Let's take a look at how the AirBAPS system achieves the necessary healing. Because of the biomechanical and functional design with the AccuAir pressure bladder, the AirBAPS facilitates a true functional reaction of the subtalar joint, entire foot and ankle complex, and the integrated kinetic chain. These are called the AccuAir pressure points. These points facilitate blood flow to the pressure points located on the bottom of the foot. The AirBAPS utilizes a predictable yet unpredictable environment and controlled stability. The surface of the airbags has vectors on it ranging from 0 to 180 degrees right and left. These vectors assure properly aligned foot placement every time. Here are some examples. The right foot aligned along the 0-degree vector reveals alignment of the right foot to facilitate plantar flexion greater than dorsal flexion and equal amounts of inversion and eversion. The right foot aligned along the R45 vector facilitates plantar flexion greater than dorsal flexion and eversion greater than inversion. The right foot aligned along the R135 vector facilitates dorsal flexion greater than plantar flexion and eversion greater than inversion. The right foot aligned along the L135 vector facilitates dorsal flexion greater than plantar flexion with inversion greater than eversion. The right foot aligned along the L90-degree vector facilitates equal amounts of plantar flexion and dorsal flexion with inversion greater than eversion. The right foot aligned along the L45-degree vector facilitates plantar flexion greater than dorsal flexion and inversion greater than eversion. The AirBAPS can be used on a variety of surfaces, including hardwood floors, carpet, cement, and tile. The AirBAPS is designed to be very durable, and a 1-year warranty is included. Cleaning the AirBAPS is an easy process. All that is needed is a simple soap and water solution. We also recommend using an antibacterial sanitizer between clients. The AirBAPS can be used sitting, standing, and partial weight bearing. As an example, the AirBAPS can be effectively utilized in a partial weight bearing standing position with the opposite foot in varying positions, such as posterior, posterior lateral, or an interior lateral, depending on the desired chain reaction. The AirBAPS can effectively be utilized barefoot as well as with a shoe. Because barefoot and with shoe create two unique interfaces, it is possible to do prevention performance and rehabilitation both barefoot and with a shoe on. Using the included air gauge, you can measure the amount of pressure in the AirBAPS. The pressure can range from 0 to 7 pounds, with 7 pounds being the maximum amount of inflation possible. The amount of inflation you provide will depend on the needs of your client. The more the AirBAPS is inflated, the more predictable the movement will be, and of course, with less air, it becomes more unpredictable. The AirBAPS is going to be effectively used by allowing the opposite foot to toe-touch surf on various parts of the BAPS to facilitate the desired chain reaction. The AirBAPS can be effectively utilized with both feet placed in various positions on the airbags, dependent upon the desired chain reaction. It can be positioned so you would get symmetrical motions in the frontal or sagittal planes, and asymmetrical motions in the frontal or sagittal planes. There are two specific benefits of the AirBAPS. The first benefit is that it is most effective when it is used with respect to prevention. Utilization a few minutes a day enhances balance, strength, and overall posture, as well as increasing proprioception. The second benefit is the AirBAPS is one of the most effective tools to utilize when facilitating functional manual reaction techniques to enhance functional motion and a weight bearing in a biomechanically designed environment. An interior view of the left foot aligned along the 0-degree vector reveals the chain reaction from the foot to the hip. The hip responds in all three planes of motion as a result of the chain reaction from the knee, foot, and ankle and the AirBAPS. The posterior view is of the left foot along the 0-degree vector, revealing a significant frontal plane motion of the hip into abduction and adduction in response to the knee and the foot, and ankle and the AirBAPS. The lateral view reveals the sagittal plane chain reaction between the hip, the knee, the foot, the ankle, and the AirBAPS. Equal amounts of eversion and inversion are seen with the posterior view, with the right foot aligned along the 0-degree vector. A medial view with the right foot aligned along the 0-degree vector reveals an emphasis on the sagittal plane motions of plantar flexion and dorsal flexion, combined with eversion and inversion along with abduction and adduction. A lateral view of the left foot aligned along the 0-degree vector reveals the function of the lateral complex of the foot and ankle because of the biomechanical and functional design of the AirBAPS. An interior view of the left foot aligned along the 0-degree vector reveals the chain reaction between the AirBAPS, the foot, the ankle, and the knee. As the foot everts, the knee abducts and internally rotates and flexes. As the foot inverts, the knee adducts and externally rotates and extends. With the right foot aligned along the 0-degree vector mobilizing the AirBAPS, moving in a clockwise rotation, creates equal amounts of inversion and eversion with more dorsal flexion than plantar flexion, and with internal rotation. The same motions with external rotation are created with a counterclockwise rotation. One of the powerful variations with the effective use of the AirBAPS is varying the speed of rotation. Utilizing the AirBAPS while facilitating motion to other parts of the body, such as cervical rotation, is an effective way to create the desired chain reaction. Another functional and effective variation when utilizing the AirBAPS is to have the opposite leg driven to create a unique chain reaction. The use of free weight dumbbells is extremely effective with the utilization of the AirBAPS. The weights can just simply be held along the side of the hips or actually be taken through various exercises while mobilizing the AirBAPS. The AirBAPS can be used effectively before any and all activities, as it is an excellent way to enhance function as a warm-up and cool-down exercise. CPT codes and billing. Physical therapists will build under neuromuscular re-education. Neuromuscular re-education is designed to engage the neurological system and the muscular system simultaneously. In order to bill for use of the BAPS, a PT must follow the 8-minute rule. They must conduct BAPS exercises for a minimum of 8 minutes. The reimbursement amount from Medicare varies according to state, so be sure to click on our link on the website under CPT codes and billing to determine the reimbursement amount for your state. Each time a clinic or PT uses the BAPS system with a patient for the minimum amount of required time, they will be reimbursed for the correct amount. How does the BAPS board pay for itself? If a clinic or PT bills each time they use the board with a client, they will be reimbursed for that time. Example: 20 patients per month times 4 weeks times 3 times per week times $46 equals $11,040 reimbursement amount for that month. The BAPS system is the best platform system on the market to rehabilitate ankles and lower leg injuries. In addition to getting the biomechanical advantage, clinics will also make additional income by using the BAPS system every day to rehabilitate their clients. Get your BAPS system today and you can purchase the system directly from the manufacturer. Go to www.spectrumtherapy.net.